Degenerative myelopathy, or DM, is a slowly progressive neurological disease of the spine in dogs. Degenerative myelopathy means deterioration of the spinal cord. The spinal cord carries information from the brain down the neck, along the back, to the limbs and the tail, and then back up to the brain. As a dog's spinal cord begins to deteriorate from DM, there's a reduction in nerve signals to the muscles in the hind limbs, causing hind limb weakness as the first visible symptom. This process has been compared to ALS in humans, also known as Lou Gehrig's disease. It wasn't that long ago that we didn't know what caused DM, but we now recognize degenerative myelopathy as a genetic condition. We usually see it in certain breeds, and it tends to be more prevalent in larger breeds. However, it can affect a variety of breeds. Some common breeds affected by degenerative myelopathy include German Shepherds, Boxers, and Pembroke Welsh Corgis. Degenerative myelopathy comes on slowly as a dog ages, often around 8 to 10 years old. Since DM occurs in the spinal cord of the back, we classically observe rear limb weakness and incoordination as the primary symptoms. Signs of DM typically observed at the time of examination include weak back legs that are wobbling, scuffing, or crisscrossing, normal front legs, and no signs of any pain or discomfort. At the time of diagnosis, most dogs have been experiencing symptoms of weakness for weeks to months. Unfortunately, dogs will continue to become weaker over the next 12 months or so until they can no longer walk. The next stage of DM will usually be urinary and fecal incontinence, and eventually the front legs will be affected. Cranial nerve signs, such as difficulty swallowing, can develop late in the disease. Soon after, difficulty breathing will arise, and ultimately the disease will result in complete paralysis if left alone. The neurological exam is the first step to diagnosing degenerative myelopathy. Various neurologic conditions can begin with hind leg weakness, such as spinal cord tumors, malformations, or even a slip disc in a stoic dog. The only true way to diagnose DM is by performing a spinal cord biopsy, which we don't do because this is a very risky procedure. So, degenerative myelopathy is typically a diagnosis of exclusion, and an MRI is the best way to rule out any other neurological possibilities. While there's a genetic test available for DM, this tells us if a dog is at risk of developing DM and is not enough on its own to diagnose degenerative myelopathy. It's just one step in the process. At 7, the steps to diagnosing degenerative myelopathy are evaluating the dog's signalment, so is this dog the appropriate age and breed for the disease? The history, meaning is the story that the owner tells us appropriate as far as onset and clinical signs they're seeing at home. The neurologic exam, of course, so are there clinical signs consistent with a non-painful mid-back spinal cord problem? An MRI and possibly a spinal fluid analysis to rule out other causes for weakness in the back legs. And then, of course, the genetic test, so evaluating if the dog has the predisposition to developing degenerative myelopathy. Sadly, there is no cure for degenerative myelopathy in dogs. Without intervention, DM will prove fatal once it reaches the diaphragm, which is the muscle that controls breathing. Therefore, a peaceful and pain-free passing via humane euthanasia is recommended once quality of life is affected. This will, of course, be a different stopping point for each family. The doctors at 7 are here to assist families through this difficult decision. Thankfully, there are some things you can do to make your dog more comfortable while living with degenerative myelopathy. At Southeast Veterinary Neurology, we strongly recommend physical therapy. Regular exercise can help reduce atrophy and weaken muscles and give you more time with your dog. In general, degenerative myelopathy can be managed with physical therapy and nursing care, such as a soft padded bed, slings to assist in walking, booties for traction, or a wheelchair to help your dog get around. Dogs whose weak back legs make it difficult to walk should always be examined by a veterinary neurologist. Limb weakness can indicate a disruption in communication between the spinal cord and the brain. Early diagnosis and treatment always provides patients with the best possible outcome.